All right, my name is Terrah, and I have stage 3 head and neck cancer, squamous cell, and I was diagnosed in January of 2019.
And just go ahead and tell us a little bit about the initial experience of the diagnosis and
Okay.
just sort of the emotions of it.
Leading up to the diagnosis, for a few months at a time, I'd say at that point I was experiencing sore throats, a lot of swollen lymph nodes, and kind of was seeking, ear, nose, and throat opinions. What's going on? Why do I feel this way? And God, it was probably 4 or 5 months of this back and forth of antibiotics. You're fine. You're young. You're healthy. I'm not worried about you. And it actually was at a football game that one of my friends worked in the medical field and noticed a lump on my neck and said, I don't know, that's kind of been there for a long time. Maybe you should follow up again. So I went back to the doctor and just kind of explained the situation again, and same thing, another bout of antibiotics. And then after maybe 3 or more visits with him, they decided to finally do a biopsy. And that was on a Friday. And Monday was Martin Luther King Day, so I was home and had the day off. I didn't think I'd hear anything till probably midweek, and got a phone call at 7:30 in the morning. Let it go to voicemail because I didn't recognize the number. And then it was, hi, this is your doctor. This is my cell phone. Call me immediately. So at that point, obviously, he wasn't calling to say, have a happy holiday. So I called him back, and I remember hearing, Terrah, you have cancer, and that's all I remember. Literally, I don't even know how long we talked on the phone. 5 minutes, 50 minutes. After we got off the phone, I actually had to text him and apologize and say, can we talk again? I have no clue what you just told me. So I'd say the first day, even telling my mom, I don't even really remember her reaction. I think it was just kind of a total blur.
Yeah, I can imagine that. So tell me, because I know you've done a lot of research, and tell me a little bit about how you, sort of after you got out of the initial phase of shock and fear, your initial process of researching and how you ultimately found Dr.V and why you decided to treat with her.
Okay, well, once the shock wears off, kind of goes into, oh no, what are we going to do mode, right? And then everyone that you're close to, and I can see this opinion now, they just want you to get better. Regardless of the carnage that's going to happen, regardless of what your body's going to go through. You know, it's so easy for your loved ones to say, oh, what did the doctor say? Okay, radiation, chemo, great, let's do it, you're fine. All these people coming out of the woodwork. I don't even know if it was maybe Netflix or something, just kind of watching different shows about health in general. And someone had mentioned on one of those sites that there's other ways to look at this. Don't rush to a snap decision. You don't have to be pushed in fear and try to react day one. So I started researching a ton of things alternative, a ton of things conventional. I mean, probably to the point of being a little bit psychotic about researching it. I talked to MD Anderson, I talked to John Hopkins, I talked to the James in Columbus, Ohio. I have good friends that actually work there. Come here, and every single time it was a cookie cutter answer. I could have told you before I even walked in and wasted my time on the appointment. The standard of care is 40 radiations to your head and neck, full dose chemo. Let's hope for the best. It was a great cure rate. You'll be fine, you're young, all these things, in and out, kind of like a conveyor belt. Every single one of them wouldn't even talk about health, what to do with my body. I'd look around the waiting rooms, and it was like I was the only one at that point that looked a lot better than the patients that were cured, if you will. So then on the flip side of that coin, I talked to a bunch of naturopaths and alternative care doctors who were way, way, way the other way. So I was having a problem. It was each version of these people were very staunch in their beliefs on their way's the only way. So then you get to alternative doctors, tons of different clinics from Mexico to Southern California to New York. All of them are the same. Don't do any chemo, don't do any radiation, eat a healthy diet, take these supplements. So it was complete polar opposites. And I'm trying to navigate the middle of this. I live in South Carolina, and I thought, okay, I'm going to be regional. I'm not going to travel more than 5 hours. It's not going to happen. It's going to be close. My family will be there, all of these things. Then I called a clinic in Southern California. I talked to people there, and I still wasn't 100% sold on any of it. I'm like, I don't know. This physician's great. Is this the person that can get me where I need to go? I wasn't quite sure of that. So later that evening, they had one of their other physicians give me a call on my cell phone, who happened to be Dr.V. I didn't answer that night. I was just so sick of the whole cancer journey. I was like, I need to curb this until tomorrow. So I text her East Coast time, probably around 10 a.m., and said, hey, sorry, missed your call. What time's good for you today? Knowing it was like, 7 on the West Coast, I'm thinking maybe she'll get me in the next couple days. My phone rings. She calls right away. Apparently she had talked to someone at the clinic and researched the case, seemed super, super confident in what she could do. I think it was maybe 2 minutes in the conversation, I texted my mom and said, okay, pack your bags, I guess we're going to California. And why is that? It was because you can tell she's traditionally trained. The fact that she was a surgeon in trauma, and if anything happens, it can be handled right away. But it's the first physician that I spoke to that can live in both worlds. So she saw the benefit in traditional treatment. Right away she told me what I did not want to hear, that low-dose chemo was going to be necessary, and basically, if not, I'm going to get worse. Everyone else was kind of like, yeah, Terrah, do what you want. That's great, we'll help you on the journey. So for the first time, I heard someone say, although you don't want to put these drugs in your body, they're necessary at certain doses. And we can do it in certain ways that you can get the benefit without totally destroying your body. And then on the flip side of that coin, she was talking about IV therapies to boost my immune system and keep me feeling great and not feeling like a horribly sick cancer patient. I looked her up, did research, watched some videos. She was a total straight shooter, which I do like, even though she makes me come here and get, the low-dose chemo, which I didn't want, but it's been super effective. I would say that. I don't know there's anyone else that brain can literally live in both hemispheres of medicine.
What was the little anecdote that she told you?
You want to know the blueberry story?
Yeah, I think it's fun.
All right. I
I don't actually know that I've ever heard it.
I knew this was going to come up. So, I saw a ton of naturopaths. I was juicing 10 pounds of vegetables and juice a day. I'm taking 70, 80, 90 supplements a day, not eating a drop of sugar, not doing anything. So, we get on our consult. I'm super happy to talk to her and tell her all these great things I've been doing. And she says, pretty bluntly, Terrah, you can sit in the corner all you want and eat your blueberries. You're never going to cure yourself. You're going to get worse and probably die. At that moment, I thought, okay, this is my person. I'll be there as soon as I can, and came out to the clinic and met her, and have been treating with her since. You went for the blueberries story, didn't you?
Well, I just think it's important because some people, whether it's from a place of denial or just hope, whatever it is, sometimes I think the key is that somebody was able to tell you the truth, even though you might not want to hear
Right. I have another good thing that was where you can trust her right away. Why I stayed and kept coming to California was because at this place there was probably 100 different modalities people could do. They're in and out, getting drug around. I remember walking to her office maybe 2 weeks as her patient, and sat down and said, Dr.V, there's all these things people are doing here. Do you want me to do other things? And she could have said yes. She could have told me to try every single thing in there. I would have spent my entire life savings on doing all these things. A lot of doctors probably would have. I've seen other doctors with other friends and other circumstances just take them through the ringer, and she said, well, you can, but it's not going to help your particular cancer in case. So at that point, that was a huge trust-building moment, I think, because any one of her patients would tell you without a doubt that she's only going to have you do things that she researches. They're science-based. She knows they're going to work. She's seen them work. And the cool thing is, I kind of joke with people and other patients that I did not realize cancer would be so relentless. I thought it was going to be easy, research on the internet, it's going to be simple. However, now I now have someone more stubborn than cancer itself, which is, to me, a good thing. She's always researching, finding new things, adjusting the protocols. So I definitely feel like I'm in good hands for all of these topics where they're concerned.